So yes, I'd like to welcome you all to the grand launch of the CBI Pfizer 2011 Workplace Health and Absence Survey. I should probably start by thanking, in the first instance, our sponsors, Pfizer. Emma's going to say a couple of words at the end, I think, but we're very grateful to them for their expertise and helping us to steer the questions that we're asking and pulling together a report. And also to our kind hosts today for providing us with these excellent facilities and breakfast, always a nice to have. The CBI has been running these surveys since 1987, so we've got a wealth of trends data going back through the years. And today I specifically want to talk about, obviously, this year's survey, which is focused on calendar year 2010. I'm going to talk to you about the trends that we've seen. I'm going to talk to you about the costs of absence, about the causes of absence, about what employers are doing about it. I think that's very important, clearly, and about what the public policy implications are. The CBI, after all, being a lobbying organisation, that's ultimately what we're getting at, is how can public policy be brought to bear to minimise unnecessary absence. So without further ado, let's start with the trends. Let's start with some big numbers, shall we? Oh, actually, quite small numbers, luckily, this year. So, first thing to note is that average absence across the UK for the year 2010 was 6.5 days. This is down from 6.7, which was kind of the last point pre-recession, and down by more than a quarter since we started tracking in the mid-1980s. The eagle-eyed amongst you, those who are aware of our survey from last year, will see that this has gone up from 6.4 last year. That's a mildly irritating statistical quirk caused by rounding. I think last year it was 6.46 days, and this year it was 6.51. So it's effectively stayed static. Is that a cause for concern, the fact that progress hasn't been made, momentum hasn't been made? Well, no, I'd say actually it's quite gratifying. Last year we celebrated the fact we'd hit a record low, but there was a very real concern that might have been an impact of the recession. Private sector employers looking over their shoulders, worrying about whether their jobs are going to be there, deciding that they're going to turn up, cutting down on the non-genuine absence and making people turn up to work when actually they probably shouldn't have done so. So I would say that a static result is a good result this year. What does that mean when it's multiplied across the economy? Well, it's 190 million working days lost. That's quite a big number. That's up from 180 million last year. Why the divergence? Well, that's actually kind of a positive labour market story. There are more people in work in 2010 than there were in 2009. So it's not reflective of rates. It's just the size of the workforce. It's not a uniform impact across the economy. Manual workers still have got higher rates of absence than non-manual workers at 7 days average per employee. I think clearly reflecting the nature of the work they're doing. And it's also much larger. It's a bigger number in larger organisations as well. Those that employ more than 250 people have got an average of 7.1 days. Those that employ less than 250, SMEs, as you know, they'd be quantified by many people, have got an average of 4.9. So quite a dramatic divergence there. I think we'll touch on this through my presentation as to why that might be. Once again, there is still a story about a public-private divide. It's 2.2 days higher in the public sector in 2010. That's down from 2.5 in 2009, so that's welcome progress, driven particularly by a fall in absence among non-manual public sector workers. Now, I think there's two things that could be going on here. One is better management by public sector employers. I think we've had sort of discussions around the room, people actually commenting the fact that they think they're seeing that. And that's welcome, possibly partly by the fact that the CBI is out here every year saying this story's there, so there is some political pressure for public sector employers to get it right. But also possibly partly a reflection of the fact that the recession hit the public sector later. They had sort of 2 years in 2008, 2009, where public spending actually increased as a percentage of GDP, that the squeeze started to be applied, or certainly was signalled that it was being applied in 2010. We're not going to be able to disaggregate this year. In fact, we probably won't be able to pick it out next year. This is something we're going to see in 2 or 3 years' time, to what extent this is a policy and practical application issue, and to what it is a factor of the labour market. But I think we can be cautiously optimistic about that. One worrying note is the fact that the gap between the best and worst performing firms has increased over the last year. The top performing quartile have got an average days absence of 2.2 days absence per employee, which is pretty amazing performance, I'm sure you'll agree. The worst performing quartile stands at 10.7 days. Now that's a very significant gap. The worst performing employer, who I shan't name, it'd be unfair to do so, stands at an average of 16 days absence per employee. Now there may be many factors for that, but nonetheless I think what this tells us that there is lots of best practice and lots of policy initiatives which firms can look at, employers can look at from their peer groups and counterparts and look to apply them in their workplace. And I think that applies to the best performers as well as to the worst performers. There's, no one has got a perfect absence management policy, although at 2.2 days I think they must be getting pretty close. So if that's the trend, what does that actually mean? Let's try and quantify that a bit, shall we? Well, the first thing is to look at the cost per employee. That stands at £760 per employee. We're having a bit of a discussion again in the wings of this meeting beforehand about the fact that it's sometimes a bit difficult to persuade your organisation that the health is a real and tangible issue. Well, there you go. There is a direct cost here. This matters. However, to get a bit more perspective on it, let's go to the really big number, which is that the absence costs the UK economy. In fact, that's probably a slightly inaccurate. Cost UK employers £17 billion per year. Now that's just in direct wage costs. That's not the total cost of absence. That doesn't factor in things like productivity, cover for absence, management time lost in sort of providing cover and dealing with the performance of those who are providing that cover. So the cost itself is actually going to be somewhat larger than that, although very, very difficult to quantify. But what does £17 billion mean? Because I think during the recession we've all become comfortable with much bigger numbers. The number trillion used to be kind of a fairy tale number, which is just next to a zillion, I think. But nowadays that's actually a very real number we're all comfortable talking about. 17 billion doesn't sound like that much in that context, does it? Well, actually, it is. I was doing some playing around last night when I was in my hotel trying to work out how to best put it into context. And I want to caveat this with that my sources for these figures were part ONS, very reliable, as good as you're going to get, part Wikipedia for town size. So please forgive me if these things are not exactly accurate to the pound. But £17 billion is equivalent to the economic output of Glasgow, or it's equivalent to the economic output of Manchester, and then half of Manchester again, just lost in direct wage costs. That's a pretty sizable number, I'm sure you'll agree. Once again, though, this impact isn't uniform across the economy. It varies across sectors. And again, there's a very clear divide between the public and private sectors. In the public sector, the cost per employee is 46% higher at £1,040 per employee. I'll come to a reason for that on the next slide. But of course, there must be those who are lower than average, and manufacturing leads the way with an average cost of £680 per employee. I think it's quite interesting given the nature of manufacturing, and something certainly we'll be looking into over the course of the year as to why exactly that might be. Of course, one of the negative stories which we always come to with this survey is trying to find out actually what percentage of absence is genuine and what is non-genuine. This year's survey, respondents have told us that sickies cost about 30 million working days a year, or about £2.7 billion. Again, to try and put that into some kind of context, sickies cost the annual output of Stockport. It's Shell's record quarterly annual global profits from the first quarter of this year. In terms of working days lost, that's 130,000 employees not turning up to work at all in the year, not one day. That's about half of Tesco's workforce never turning up through the front door. Clearly, this is an area where there is much to do to really clamp down on absence that is avoidable. But what's causing it? Well, the key thing is that once again, it's non-work related illness and injuries at the core. I think 93% of firms identified that illnesses or injuries picked up outside the workplace as one of the top 3 drivers of absence, followed by recovery from operations, which is identified by 43% of respondents. However, work-related illness and injury is still a driver itself, but there's quite a big divide there between manual and non-manual workers. With manual workers, 36% of respondents identified work-related injuries and illness as a cause of absence, but that falls to 16% in non-manual workers. Again, part of this is inevitable, and it's the nature of the work that they're doing, but surely there is room to squeeze that gap as much as possible. Sticking on manual workers, looking at short-term absence, back pain and other musculoskeletal disorders are right at the top of the agenda. Again, this is not going to come as a shock to anyone, I don't think. But there are lots of things that you can do to ensure that you've got processes in place, to ensure that things are done ergonomically, that staff have got the right training, and to try and minimise what can actually be quite avoidable absence. However, it's not just about people picking up boxes badly. And I think as a sign of the complexity of absence and the difficulty of addressing the issue, a fifth of respondents told us that personal issues are a key driver of absence. That's looking at things like drug problems, family problems, relationship problems. And I think for us, the key takeaway from that is it's absolutely essential that firms have got a really robust return to work process, interview process in place to ensure that you've tailored the policies you're putting in place to help someone back into the workplace to their particular needs. What someone in that situation needs is very, very different to that needed by someone who's got a bad back. And it's hopeless if you try and approach them in the same manner. Now, long-term absence, this for me is the key difference between the public and private sector. It accounts for about 1 in 3 days of absence over the year, but only about 1 in 10 incidents of absence. Again, that's kind of natural, but we'd expect that to follow. But the very big divide then is with the public sector, where that rises to 49%. Clearly, in my mind, there is no particular reasoning why public sector work would lend itself to longer term absence. And I think if we want to see the public sector chipping away at its absence problems, clamping down on the longer term absence is the most productive area for it to start doing so. So that's trends, costs and causes, but what are employers actually doing about it? Well, the first thing to note is that employers clearly recognise it's a problem. 95% of firms have actually got a formal absence policy in place. We don't actually test what that is exactly and what people define as formal. For some companies, I'm sure that is a statement that we will not tolerate absence where it's not appropriate. But people clearly see this as an issue. This will have been determined at senior levels within their companies, and I think that's very welcome. Why do they do that? Well, I think 2 reasons. One is, and both very, very business focused, I think. Let's not try and be fluffy about this. First is, it's just an absolute given that this is good for employee engagement and recruitment and retention. If you're not seen to care for your staff, you're not going to get good staff. But the second thing is, as discussed, there is a very tangible cost to this. And if you've got a board who are focused on the bottom line, and I'm sure you will do, then managing absence effectively is essential. Over a third of respondents this year have actually got a formal policy to reduce absence year on year. Again, there's a public-private divide here to a certain extent. This rises to a half in the public sector, and I think that reflects the particular challenges in the public sector employers are facing this year to squeeze labour costs in whatever way they possibly can. What's interesting then, and I have to say this surprised me as someone who's fairly new to this, is that actually there aren't policies to reduce absence year on year in 62% of employers. But anecdotally, we found that's because people feel that if they set a target, it becomes a target from the other direction as well, and employees will think that it's an entitlement. So interesting that there is that sort of divide between certain sectors of employers. As ever, the line manager is absolutely crucial to managing absence effectively. You see here some of the tools which employers are utilising to make sure that the person who is closest to the employee is the person who's helping them get back into work, doing the right kind of work. Return to work interviews by 3/4 of firms, more than half, placing that responsibility with the line manager rather than with, say, an HR function. And 43% of firms supporting their line managers to do so through training policies and the like. Another factor, which again is clearly redolent of findings from previous surveys, is that it's no use just having a softly approach and welcoming excellent employees back into the workplace, smothering them with kindness, nor is it appropriate to take an overly harsh approach to the issue. It requires both the carrot and the stick. On the carrot side of the balance, around a third of employers told us that they are looking to invest in occupational health support in next year, and over a quarter said that they employ flexible working to help those who are returning into work do so in a manner that works for them. But the stick is essential as well, and 70% of those who took part in our survey had taken disciplinary action over the course of the year, be that through warnings, dismissals, or a combination of the two. Once again, slight divide here. This is a slightly softer one. This isn't. We can't give you a percentage on it, but we asked people to rank which methods of absence management they thought to be effective, and public sector employers thought that a far wider range of methods were more effective. Well, this again seemed kind of sensible to me at first inspection, that the more tools you have available, the more likely you are to be able to find the right tool for any given employee. However, we do have this divide. And I think that, again, an area that the public sector might well want to look at over the course of next year is whether actually ruthlessly applying a smaller number of policies might be one way for squeezing better results out. So looking to the future, what are employers going to be up to? Well, 3/4 have identified well-being as a business as a priority for this year. Of those, 30% have said that it's a top level business priority, so the board have signed off on it, it's one of the things they want to do, and 47% have said that it's a top HR priority. Again, clearly quite sensible in a world in which, still in the private sector, people are looking to make sure they manage their labour as effectively as possible, given the cost-constrained nature of the times. What this means is that a fifth of respondents bravely said that it's actually not a priority for this year, which I think is brave in a survey like this, but it's probably truthful given the uncertain nature of the economic recovery at the moment. 9 out of 10 firms currently offer stress management support, with stress and mental health issues still being a key driver, particularly of long-term absence. And they've used a range of tools to help do that, again identifying the top 3 that they've identified here, where 80% are using counselling services, 75% are using occupational health support, and again, I've already mentioned flexible working on the previous slide. There's a big divide here between those firms that use formal and those that use informal structures, and actually, when you go through and do the analysis, actually the outcomes aren't wildly dissimilar. Informal tends to be more used, informal arrangements tend to be more common in the private sector. This, though, is almost entirely driven by the fact that informal arrangements are found in smaller employers, and you don't get many small employers in the public sector. So it's an interesting dynamic, and I think one that we see throughout all of the public sector, private sector divides is the fact that we're dealing with bigger employers with the issues that raises. Looking further to the future, 3/4 of employers, I think 74%, plan to beef up their occupational health advice over the next few years, really looking to integrate absence management into their business. But the important thing is that this doesn't have to be an expensive process. This doesn't mean spending cash which is difficult to get your hands on. And 2 of the key things which respondents identified were praise for a job well done. 61% of firms said that ensuring that people are praised when they've done their job effectively. And honest and timely feedback identified by 57% of respondents are absolutely essential to boosting employee morale, making sure that they feel valued in the workplace. So what are the implications for public policy? So this is kind of the CBI's raison d'etre. This is what we do. Well, the fit note is the big issue of the moment. And last year we asked people, we surveyed people in January and February last year, I think, so we were asking them before the fit note was introduced in April, and 3/4 of firms told us that they thought it would help them with their rehabilitation policy. So that was a big tick, and the last government deserves credit for introducing the fit note, finally. But this year's response has been a little bit disappointing, I think, in terms of how the fit note has been introduced in its first year. Less than a quarter, 23% of respondents told us they found the fit note useful so far. 42% have used the fit note to guide occupational health interventions. Clearly a proportion of those have used them but not found them useful. I think it's interesting as well. And just 1 in 8 employers feel that GPs have had sufficient training to differentiate between the fit note, indicating what an employee can do, and the sick note, saying what they can't do. Not just the CBI who feels this gratifyingly. Lord Freud, who's the minister responsible, said in a speech back in February that this has not been uniformly rolled out. But I don't want to be despondent about it. First is that nearly a quarter have said they found it useful, and we are only 1 year in after all. I don't think we would expect yet 100% of people to be gushing with praise for a new process. So that's one thing to note. The second is that we've got a real opportunity this autumn, and it's a government autumn, so it might well be 2012, with the rollout of the e-fit note, which is absolutely essential. I'm sure Rob and I will touch on this, and we might touch on it in the Q&A, but actually doctors as well are looking forward to this rollout. Using that as an opportunity to reinforce the training, the communication, the education that goes around exactly what's the fit note for, what do employers find useful, what's going to really add value. So, in summary, we've had welcome progress this year. I think the figures remain static, but given the labour market, I think that's something that we should be pretty happy about. We were a retention of a record low, effectively. But let's not be complacent. This is still a significant cost, £17 billion, so it's not a small cost, and particularly in the public sector. And the government looking to squeeze money wherever it can. We've calculated that the government would save £5 billion before the end of the Parliament, so that's over the next 4 years, if public sector absence fell to the same as that of the private sector. It doesn't beat it, just matches it. Employers clearly are playing their part by investing in their employees. That's absolutely essential. There should be no sort of sense in which employers aren't looking to get stuck in. But that performance is not uniform yet, and there's clearly much best practice to be shared. And some role for government policy. And to finish, the government sickness review, being led by Dame Carol Black and David Frost of the Chambers of Commerce, is a welcome opportunity to make sure that progress is maintained and that the journey from short-term absence doesn't become a trip to long-term absence towards future disengagement from the workforce. So that's the CBI's Absence Survey 2011. I'd like now to hand over to Dr. Hampton to talk about things from a more practical perspective, I think.